Hello, my name is Todd Harvey. I am a programmatic nurse specialist for addiction medicine here at UPMC Mercy in Pittsburgh, Pennsylvania. And I wanted to thank you all for giving us the opportunity to share some of the work that myself and my colleagues have been doing here to address stigma for patients living with addiction. So at UPMC Mercy, we're approximately a 400-bed acute care hospital adjacent to downtown Pittsburgh.
My name is Charles Guthrie. I'm the clinical director for UPMC Mercy. I oversee the trauma, burn, and addiction medicine service lines. In 2019, we took a look at our addiction medicine services here at UPMC Mercy and really wanted to take a wider view and understanding of how we care for our patients, not only in our medical detox unit, but in all of our areas. In doing that evaluation, we noticed that there was a need for a role that would support the education of all of our team members. So with the work of myself and the CNO, we looked at roles that were available in the system and landed on Programmatic Nurse Specialist. That role was dedicated to really look at and support all of our inpatient nurses and help educate them to understand what biases that they may have and help mitigate those so we can better care for our patients who are suffering from substance use disorder, and we can help them along their journey to getting better and really wanting to make sure that our staff feel empowered to be a partner in that education.
Hello, I am Erin Flanagan, Unit Director of the 12E Medical Progressive Care Department. 12E is a 41-bed medical progressive care department caring for acutely ill patients with a wide variety of diagnoses. Patients are admitted directly from the emergency department or from the intensive care department. In 2019, we dedicated 8 beds to care for complex medical patients with both medical and behavioral health and/or addiction medicine. Pre-COVID, the ratios were 4 patients to 1 nurse to provide the extra time and attention needed within this population. This extra time allowed the staff to make connections to the people, not just their patient, they were caring for. Unfortunately, with COVID, those ratios have increased as we tackle staffing challenges. In addition to the nurses, we have patient care technicians to support not just the nurses, but the patients as well.
The challenge for our nursing staff on 12E was balancing their commitment with some role insecurity. The commitment was certainly there in our interviews with staff. They wanted to work with patients living with addiction. However, they had questions. What do you say to patients with significant life challenges? I don't know the resources for patients with addiction once they leave the hospital, and I don't know what to say. Addressing staff needs during COVID required adaptation. Education had to be concise, and it had to meet nursing staff where they are, at the bedside. We gave weekly huddle talks. These covered the nuts and bolts of addiction, also various topics to help build therapeutic relationships with patients. Newly hired 12E nurses did brief shadow experiences with the addiction consult nurses to observe, to ask questions, and practice while getting real-time feedback. And we continue to do staff rounding to check in on staff on the unit after they had done shadow experiences with us. Our next steps, of course, we're going to continue educating, continuing our weekly huddle talks, as stigma is always a moving target, and we'll continue to empower 12E staff. As they've developed expertise, they've sought to do projects throughout the hospital addressing stigma and other topics related to recovery, so we will continue to empower them in serving patients with addiction. Thank you so much for listening to our story, and we appreciate all the support and work that you do as well.